Welcome to the part 2 of this session, how to prevent pregnancy. In the introductory class, I don't tell now wetin unwanted pregnancy dey. I say unwanted pregnancy na pregnancy wey be say you no plan for, you no desire am, you no prepare for am, but you are already pregnant. I also tell now say the best way of preventing unwanted pregnancy is using contraceptive, and I tell now say contraceptive are method that you can put in place, alright, to prevent pregnancy. And I tell now for that introductory class say there are many problems that are associated with pregnancy, and I don't tell now the problem. In case you never watch that introductory class, pause this video and go back and go watch am, so that maybe you know the problem that are associated with unwanted pregnancy. Now in this video, I want to tell now one method that you can use to prevent pregnancy. Remember I say for the introductory class, I tell now say it can be oral method. That means the method wey be say you dey swallow drug, number one. I also tell now say there is oral method that is called injectables. Injectable means say they dey give you a drug in form of injection. I also tell now say there is barrier method. I also tell now say there is emergency contraceptive. I also tell now say there is another method that is called permanent method of contraceptive. So this method of contraceptive, I will discuss them one by one per session, per video. So make sure say you watch the introductory class and you watch the subsequent videos, alright. But for this video that I'm doing now, the method I want to discuss is what we call oral method of contraceptive pill. From the word oral, I mean say you dey take the drug, you dey swallow the drug, alright. You mean say you dey take drug wey go prevent pregnancy, and this drug you dey swallow am. You no dey give that in form of injection. This oral method gets two types. You have one wey they call combined oral contraceptive pill. You also have another one that they call mini pill. Now let me start with combined oral contraceptive pill. Combined oral contraceptive pill simply means say it contain two things. That drug contain two things: estrogen and progesterone. And the way that drug dey work, e dey make woman no dey ovulate. And you know say woman no ovulate, woman no go get belle. Another thing wey that drug still dey do is that e dey cause thickening of the cervical mucus, so that sperm no go fit go reach where egg dey, and sperm no go fit fertilize the egg. So na that two things dey do. And when you do that two things, woman no go get belle. The drug na very effective drug. If you buy the drug, you go see say the drug come in 28 tablets. If you count am 1, 2, 3, 4, you go see say na 28 e be. And that one means say you dey take one tablet every day, one tablet every day. You no go forget, you must take am one tablet. If you want it to be effective, you dey take am one tablet every day, one tablet every day. So the advantage of this drug, because I tell now say every method of contraceptive get advantage, get disadvantage. So I go tell una the advantage and disadvantage of all of them. So make sure say you watch all the video. So the advantage of this combined oral contraceptive pill is that number one, it is effective. If you dey take am one every day, you no go get belle. Number two is that it is reversible. Reversible means say anytime you come decide say you wan get belle, once you stop the drug, you go fit get belle again. You know say some women dey talk say I wan give 2 years gap, alright, so that my first child go use 2 years senior the younger one. So they come take drug, that combined oral contraceptive pill, for that first 2 years. After the baby decide say they wan get belle again, once you stop that drug, you go fit get belle. So it is reversible, alright. Anytime you stop the drug, you go to get pregnant. Another advantage of this drug be say some women, this drug dey reduce chances or risk of having ovarian cancer and endometrial cancer. Ovarian cancer na simply mean say cancer of the ovary, while endometrial cancer na cancer of the womb. Now if you dey take this drug dey reduce the chances of you having cancer of the ovary and you having cancer of the womb. If you dey take this drug, you dey reduce that chances. So those are the advantage. But the disadvantage of this drug, you know say some women no like stress. They say I want to take drug every day. So that's the number one disadvantage. You have to be taking it every day, alright. The number two disadvantage is that this drug, if you dey breastfeed, you no fit take this drug. This drug no be for women wey dey breastfeed, women wey dey lactating women. It's not for lactating women. Why? Because this drug, if you dey take am, e dey reduce production of breast milk. So women wey dey lactate no dey take this drug. Then the third disadvantage is that this drug does not protect against sexually transmitted infection. So this one na be the disadvantage. I don tell you the advantage of combined oral contraceptive pill. I also tell you the disadvantage. So the other method of that, the other drug that's also taking oral is called the mini pill. Remember I tell you say for that combined oral contraceptive pill, the one I explained before, I tell you say it contain estrogen and progesterone. But this mini pill, what they call a single pill, alright, it contain only progesterone. And the way they work, it dey cause thickening of the cervical mucus so that sperm no fit reach where egg dey and fertilization no fit take place. Na the way take dey work be that. And this drug also dey come in 28 tablets, alright. It also dey come in 28 tablets. That means you dey take the drug one every day, one every day, one every day. No dey miss am, alright. But the advantage of this drug is that number one, it is effective. You dey take am regularly, the way doctor take say make you dey take am one every day, you no go get belle. Number two, it is reversible. Anytime wey you decide say you wan get belle, once you stop, you go get belle again, alright. Number three, the advantage is that the third advantage is that you can use it for women that are lactating. Remember I tell you say for that combined oral contraceptive pill, woman wey dey lactate no fit take am. But for this mini pill, this single pill, woman wey dey breastfeed, woman wey dey lactate fit take am. So those are the three advantage of the mini pill. Number one, it is reversible, it is effective. Number three, it can be used for lactating women. The advantage of this drug, you know, say some women no like stress. They say, I want to take drug every day. So that's the number one disadvantage. You have to be taking it every day. Alright. The number two disadvantage is that it does not protect against sexually transmitted infection. That one means say if your man get infection or you get infection, you fit transfer the infection, or your man fit transfer the infection give you. It does not protect against infection.